Deepak has always believed in the philosophy of living life to its fullest.
My name is Deepak Vignesh. And yes, I finished my aeronautical engineering in Chennai. And now I'm taking care of my dad's business. Dad runs a construction company and we take care of it together. And he's like a friend of mine and we go together for the bike rides and all. And we go for clubbing, dinner outside, movies. That's how we keep ourselves entertained. And from morning to evening, it will be completely business.
He was a healthy, normal, hardworking man who was about to become a father. He had no idea that a routine checkup would turn his life upside down and life would never be the same again.
I've had this gastric trouble for this around a couple of months, but it was very mild. But then it was an accidental situation. I did not have anything specific that I had to go to the doctor. But then when my dad was in the medical checkup, the health checkup, he goes yearly once. I was accompanying him to the checkup. So when the Dr. BPS, he was like, why don't you go for a master checkup? I went to the ultrasound where the doctor got up with something and he told me to go for a CT. So I was wondering why should I go for a CT because I'm perfectly all right. So and then he told me no, it's just like the routine health checkup. So you should go for the CT. So when I went to the CT, I finished the CT scan. The reports were out, and then it showed that I had a tumor on my left kidney. So then I came back home. When I was trying to search on it about the tumor in the kidney, it showed something called renal cell carcinoma, which is familiarly called as kidney cancer.
Deepak was diagnosed with kidney cancer at the age of 23.
I was married on February month, and on the end of May, I went through this master checkup. And when the reports went to Chennai, I got to know that I had kidney cancer. I could not take it easily. See, even I'm 24. When I got to know I had kidney cancer, I had a family. My wife was pregnant. I had my sister, who's not married, and parents. I was thinking about all these, my friends and everything. Losing my kidney or losing my life, that was totally secondary compared to all other people, other people who were around me. So taking care of this situation. So I could not sleep around for 2-3 nights. I don't know what is happening inside. I felt like that I was broken, completely broken into half.
Deepak was told by most of the doctors that he would have to lose a kidney to cure the cancer. But he was determined to do whatever it took to beat cancer and save his kidney.
Here in Coimbatore, they suggested me to remove the kidney. Since even the tumor was small, I didn't know why. Wherever I went 2-3 hospitals in Coimbatore. Most of the doctors told me, no, it cannot be done. People with one kidney, they face a lot of issues, Some might even lose their lives. Even the other kidney can go into a failure thing. And you should be very restricted in terms of diet and other things. I don't want to do it because I'm just 24. There's a lot other things to be enjoyed in the life, even in the food. I don't want to be restricted in my lifestyle, I cannot take it. I could not take it. So that was my position. So I didn't want my entire kidney to be removed, but there were no other source. Till I went to Apollo to meet Dr. Raghavan, there was no other source. Everybody I see tells me to remove the kidney.
So this young man was referred to me by a very senior medical oncologist with a newly diagnosed small renal tumor in the kidney. He came to my office absolutely in panic mode. He was recently married and he was expecting a baby, and he was told that you are having a renal cancer. And I really felt sorry for him because your life suddenly changes once and for all when you hear the term cancer. Especially in such a young age and in such unexpected circumstances. He wanted to try an option to preserve the kidney, and he was also keen that he gets a minimally invasive operation. So this was the background with which he came to me.
Deepak explored all the possible options for his treatment and finally he chose to go with robotic surgery.
We had a lot of pre-operative preparation. So I sat with my colleague who came to assist me for the operation and my radiology colleague. We sat down, we literally mapped the kidney to know exactly where the tumor is using the scans, and that mapping we want to translate during the operation time. So even before the operation, we had mentally made our mind what exactly is going to be the steps of the operation, where I'm going to find what I'm going to find. We know that if I cut a disc of the kidney, I will find the tumor inside. So I did a cut of the disc of the kidney, found the tumor inside, took a margin of the tumor as well, delivered it, and then closed the defect down. We managed to finish within 23 minutes of the clamp, and as expected, Deepak made a superb recovery.
Post-surgery, Deepak had a speedy recovery and went back to enjoy his time at home.
Yes, I'm extremely happy. It has almost been 1.5, 2 years almost since my surgery, and I forgot everything. And I am sometimes aware of what I'm going to have, the food, my workouts, my walking, jogging, and my regular routine health checkups, ultrasound scan, 3 months once, which I'm doing a follow. And I'm very happy with my family.
He has not had any recurrence of cancer. He has had a baby girl and he's a very happy guy. The tumor came out as cancer, but it's a cancer which has what I would describe as a favorable prognosis, meaning it's very likely that what we did is all he required for his lifetime. But time will tell. We have to keep him on a close follow-up, but he is doing extremely well.
Deepak is grateful to be on the other side of treatment today, and he cherishes every moment that he spends with his family.
I have a daughter, and I always wanted to have a daughter, as I had a sister, and I have seen my mother, and she has few sisters, so I always wanted to have a daughter. You can what do we say? You can call your daughter a beta. You cannot call your boy as a Betty. This is what. So daughter's love is always important, and it's very good. And after she came into my life and everything started changing, even this, even my cancer was found out even when she came into my life. So she's my everything, like what my sister and my daughter, they are my everything in my life. I live for them. I live for my family. More than myself, I live for them. So to make them happy and keep myself happy, that is how it is.
Staying active with work and family has given him many reasons for survival and provides welcome diversions from his past.
Hello everybody, I'm here to give you an update on Mr. Deepak and Mr. PC Jain. Mr. Deepak has been convalescing exceptionally well. It was truly an incredible moment for this young man to be free of cancer and yet preserve his kidney. Mr. PC Jain is also back to good health with no trace of cancer or incontinence. Folks, robotic surgeries entail using state-of-the-art technology. They allow for strikingly less invasive surgeries with minimal blood loss, faster recovery, reduced risk of infections, and the best part, lower levels of pain. When you consider a robotics program, given the really steep learning curve associated with the use of this technology, it is imperative you select a provider that has done this many times over. Till we meet again next week on Let's Talk Health, remember life is priceless. Goodbye for now.